Hello students, welcome to Enamel Heroes. I hope you all are doing well. So by seeing on the screen, you all have guessed the topic for today. That is trigeminal nerve, its course and branches. So by looking at the first image, I'll be discussing about the trigeminal nerve, its branches, that is ophthalmic, maxillary and the mandibular. And in the second image, you can see the 3D view of the trigeminal nerve. Later on in the video, I'll be discussing about the trigeminal neuralgia. So let's get straight to the topic. Trigeminal nerve is the fifth cranial nerve. Trigeminal nerve is the fifth cranial nerve and it has three parts. It is divided into three parts, means it has three branches. First is the ophthalmic, second is maxillary, and then third is mandibular. The first two branches are pure sensory and the mandibular branch is a mixed branch, means it's the combination of sensory plus motor. Okay. So here in the image you can see I have drawn the trigeminal ganglion. Okay. The three branches are emerging out from the trigeminal ganglion. The first is the ophthalmic, then maxillary and then mandibular. This orange color structure that I have drawn, this is representing orbit. So V1 is the ophthalmic nerve. Before it enters the orbit, it splits into three. It gives three branches in the orbit. The first branch is the frontal nerve. Second branch is the nasociliary nerve. And in the second branch, there is a ciliary ganglion. The third branch is the lacrimal nerve. Now the frontal nerve supplies to forehead and scalp region. And the second branch, that is the nasociliary nerve, it further divides into two and gives the two branches, that is anterior ethmoidal nerve and posterior ethmoidal nerve. Now the third branch of the ophthalmic nerve is the lacrimal nerve. Now let's come to maxillary nerve. As you can see, I have drawn this structure that I am outlining with yellow. This is representing the maxilla. Okay. So basically maxillary nerve, it emerges from trigeminal ganglion and it passes through a foramen. And which is the foramen? The name of the foramen is foramen rotundum. Maxillary nerve passes through foramen rotundum and before it enters into the maxilla, it gives one more branch, that is, as you can see, this branch. Before it enters into the maxilla, it gives one branch, that is posterior superior alveolar nerve, and where it supplies to the maxillary molars. It supplies to the maxillary molars, but except the mesiobuccal root of the first molar. It does not supply the mesiobuccal root of the first molar. Okay, now the maxillary nerve, it enters into the maxilla. As you can see, it enters into the maxilla. So this structure that I am drawing with green, where basically this nerve passes, since this structure is below the orbit, so we can say floor of the orbit, and this structure represent the roof of the maxilla, means this is the uppermost part of the maxilla and hence it is called the roof of the maxilla. The second nerve passes through the floor of the orbit and this nerve is called infraorbital nerve. Infraorbital nerve is a continuation of maxillary nerve. Inside the maxilla itself, this infraorbital nerve gives two branches to the anterior tooth. First is the middle superior alveolar nerve and the another branch is the anterior superior alveolar nerve. Okay students? And all these three branches of maxillary nerve, that is posterior superior alveolar, middle alveolar, superior alveolar and the anterior superior alveolar, they supply to maxillary sinus. Where they supply? They supply to maxillary sinus. Okay. let's understand the course of maxillary nerve. It is very important, student, in viva also, and in your professional exams also. I mean in your theory exams as well as in viva, they ask you about the course of maxillary nerve. It's very important. So let's study the course of maxillary nerve. First of all, maxillary nerve originate in the middle of semilunar ganglion. Remember star mark where maxillary nerve originates. So the maxillary nerve originates in the middle of semilunar ganglion. Then it continues forward in the lower part of cavernous sinus. Where it continues? It continues forward in the lower part of cavernous sinus. Then it passes through a foramen, and the name of the foramen is foramen rotundum, and then it passes through foramen rotundum. After passing through foramen rotundum, it leaves cranial fossa and enters to a pterygopalatine fossa. एक fossa को leave करती है. Which fossa? It leaves cranial fossa and enters to a pterygopalatine fossa. Okay. After entering into the pterygopalatine fossa, it enters inferior orbital fissure. It enters inferior orbital fissure to pass through the orbital cavity. Then after passing through the orbital cavity, it turns laterally on infraorbital groove. It turns laterally on infraorbital groove. And then finally through infraorbital foramen, it emerges onto the face. I hope the course of the maxillary nerve is clear. Now, let's understand the branches of maxillary nerve. Students, the entire trigeminal nerve, which is the fifth cranial nerve, is very important for your professional examination. They can ask you in viva, they can ask this question in oral surgery viva, they can ask in anatomy and much more. So it is very important for you to understand thoroughly each and every nerve, the course, its branches, and what branch supplies which structure. So just focus here. I'll be telling you about the branches of maxillary nerve. So basically maxillary nerve gives the branches in these basically four regions. First is the middle cranial fossa. Second is the pterygopalatine fossa. This is first area. Second, this is third, and this is fourth. In middle cranial fossa, it gives one branch, that is middle meningeal branch, and it supplies to dura mater. Okay. Now in the second region, that is in the pterygopalatine fossa, it gives three branches. The first branch is the ganglionic branch. Second branch is the zygomatic branches, and zygomatic branches, it further split and gives two branches, that is zygomatico-temporal. It supplies in the temple regions, and second branch is the zygomatico-facial, where it supplies sensory fibers to skin. Okay, it supplies sensory fibers to skin. Now the third branch in this region is posterior superior alveolar nerve. As I have already explained you while I was explaining about the maxillary nerve, their course, it supplies to maxillary molars, their gingiva, except, students, it is very important, star mark, examiners usually ask what structures are supplied by PSA, means posterior superior alveolar nerve. So basically it supplies us the maxillary molars except the mesiobuccal root of the first molar, Okay. Now let's get to the third region, that is in infraorbital canal. Infraorbital canal, it gives two branches. First is middle superior alveolar, second is anterior superior alveolar. As I have discussed, The middle superior alveolar, it supplies bicuspids, and anterior superior alveolar, it supplies anteriors, means central incisor and lateral incisors. Okay. Now let's get to the fourth region, that is on the face. On the face, it gives terminal branches. And what are the terminal branches? First is the palpebral. Which structures are supplied by the palpebral? Palpebral basically supplies lower eyelid region. Okay. Labial, it supplies lips. Nasal, it supplies to the nose region. Okay. So I hope the branches of maxillary nerve is clear. Let's get to the another very important nerve, a very important part of trigeminal nerve, that is mandibular nerve. See student, this is also very important. I am telling you, I am repeating again and again. The entire trigeminal nerve, which is the fifth cranial nerve, is very important for your professional exams. They ask in Viva also, they ask in theory also. Okay. So let's study about the mandibular nerve. First of all, mandibular nerve is a mixed nerve. Mandibular nerve is a mixed nerve. Mixed nerve means it is both sensory as well as motor. It is both sensory plus motor. As you can see in the structure, in the image, mandibular nerve, it passes through foramen ovale. Mandibular nerve passes through foramen ovale, and immediately after passing through foramen ovale, it gives one branch back to the brain, that is nerve to spinosum. The name of the branch is spinosum. Nerve to spinosum. And which structure is supplied by it? It supplies dura mater. And this nerve to spinosum, it passes through a foramen. This is the foramen, and foramen is foramen spinosum. And now this is the main trunk of mandibular mandibular nerve. Before it splits into anterior and posterior division, it gives two branches. First is medial pterygoid muscle, and the second is tensor villi palatini or tensor tympani. See student, this is a star mark question. Medial pterygoid muscle, this is the only muscle of mastication which is supplied by the trunk. Trunk means the main mandibular nerve. Main mandibular nerve means the main branch of mandibular nerve before it gets split into several other branches. The main trunk is basically supplied to medial pterygoid muscle. Okay. So the main trunk, this is the main trunk, and it divides into two divisions. The first is the anterior division and the posterior division. Okay students, I hope till here it's clear, the topic is clear. So the mandibular nerve, it divides into anterior division and the posterior division. So anterior division, it supplies to lateral pterygoid, masseter, temporalis and the buccal. Students, just focus here, it is very important. These three, lateral pterygoid, masseter and temporalis, they are motor nerves. And my friends, buccal, this is sensory. Just focus here. Buccal, it supplies skin and mucosa of the cheek. So this basically branch, it supplies to the skin and the mucosa of the cheek, and it also pierces buccinator. It also pierces the buccinator muscle, but but it does not supply it. It does not give any kind of supply to the buccinator muscle. It only supplies to skin and the mucosa of the cheek. Very frequently examiner or the external examiner, they ask this question in the viva. So is buccal nerve to buccal, it supplies to buccinator muscle or not? No, it does not supply, but rather it pierces the muscle, but it does not supply anything to the muscle. Okay, now let's come this side, that is a posterior division. So I'll be giving you the mnemonic for it, that is Ali. Okay, so A stands for auriculotemporal nerve. Auriculotemporal nerve, and what are the structures that are supplied by auriculotemporal nerve? It supplies skin of auricle, temple, TMJ and parotid gland. The second L stands for lingual nerve, where it supplies, it is responsible for general sensation from the anterior 2/3 of the tongue. Then as you can see, okay, and the third Ali, the I stands for inferior alveolar nerve. Before it enters to a mandibular canal, this is the mandibular canal, it splits, means it gives one more branch, that is nerve to mylohyoid. It gives one more branch, that is nerve to mylohyoid, and supplies to mylohyoid and anterior belly of digastric muscles. Before inferior alveolar nerve, before it enters the mandibular canal, it gives one more nerve, that is nerve to mylohyoid, and it basically supplies mylohyoid and anterior belly of digastric muscle. Okay, now the inferior alveolar nerve has entered the mandibular canal and it is supplying to the mandibular teeth. And finally, it passes through mental foramen and emerges out as mental nerve. And mental nerve supplies skin of the chin. Okay, mental nerve supplies skin of the chin. I hope this mandibular nerve is clear. Now I'll be telling you about the injury. If the mandibular nerve get injured, either in surgery or due to some other reasons, maybe accidentally, if this nerve gets injured, what happens? This is very important. V3 stands for mandibular nerve. It's V3. You can also say this is 5 in Roman, and 3 is because this is the third division of trigeminal nerve, and this is the sign of injury. If the mandibular nerve gets injured, what happens? There is ipsilateral jaw deviation. There will be deviation of your jaw, ipsilateral. Okay. So that's it for this video. Thank you, students. So in the upcoming video, I'll be discussing about very important topic that you cannot miss, and that topic is a very important topic of examiner. This question can come in short note as well as in long note form. And what is the question? You cannot miss. That is trigeminal neuralgia. This is a very important topic, friends, and you cannot miss this topic. So for now, that's it for this lecture. I hope I have cleared all your doubts and made this topic a bit clear. So thank you so much and see you in the next class.